Hello everyone, my name is Sunny Rana and I will be providing the pharmacy updates for September. This presentation will include information about available generic inhalers, a new FDA indication for Trelegy, a new FDA drug approval, new dosage strengths for Trulicity, a new dosage form of Tramadol, and a new drug added to the Cone Health formulary. First, we will discuss the available generic inhalers at pharmacies. There are 3 generic albuterol inhalers available, one for each brand-named inhaler. There is also a generic levalbuterol inhaler. These all contain 200 puffs and are HFA inhalers. The out-of-pocket prices for the generic inhalers vary from the brand inhalers. For example, a brand ProAir inhaler on GoodRx will cost about $74, while the generic will cost about $19. There are also generic inhalers containing fluticasone and salmeterol. On the left is the Advair Discus generic inhaler. On the right is a picture of the brand AirDuo Respaclick and the generic inhaler. Respaclick inhalers are similar to Discus inhalers, where opening the cap loads the dry powder and a forceful inhalation is needed. The GoodRx prices for these inhalers are indicated in this chart. Now, we will talk about a new FDA indication. Trelegy Ellipta is the first triple inhaler approved for asthma, but only in adults. Trelegy contains fluticasone, umeclidinium, and vilanterol. The 162.525 microgram strength was already approved for COPD, but a higher strength containing 200 micrograms of fluticasone is now available for asthma. The CAPTAIN study, or clinical study in asthma patients receiving triple therapy in a single inhaler, is the phase 3 trial that helped get this new indication approved. There were 6 intervention groups, 2 of which are fluticasone vilanterol or Breo Ellipta. The primary outcome was change in FEV1 from baseline, and one of the secondary outcomes was the number of moderate or severe exacerbations. The treatment groups were grouped into either having fluticasone vilanterol only, having 31.25 micrograms of umeclidinium, or having 62.5 micrograms of umeclidinium. The total number of events in each group were determined. A reduction of total events was seen but was not statistically significant. Lung function did improve in the groups that included umeclidinium. Now we will talk about a new FDA approval. Breztri Aerosphere is a triple inhaler that contains budesonide, glycopyrrolate, and formoterol. It is indicated for COPD and was approved in July. It is still not available, but should be in the near future. Now we will talk about a new dosage strength. The FDA approved 2 higher doses of Trulicity or dulaglutide for treatment of type 2 diabetes. These are the 3 and 4.5 milligram doses, which are the top 2 pens on the right. The Award 11 study allowed for the approval of the higher doses of Trulicity. Patients were initiated on 0.75 milligrams once weekly for 4 weeks, then underwent stepwise dose escalation every 4 weeks to the randomized dose of 1.5 milligrams, 3 milligrams, or 4.5 milligrams. The higher doses were shown to have statistically significant more reduction in A1C and body weight, but also had more incidence of GI upset, which is a known side effect of the medication. Next, we will talk about a new dosage form approved by the FDA. Qdolo is an oral solution dosage form of tramadol that has recently been approved. It comes as a 5 mg per milliliter strength and is also a Scheduled 4 controlled substance. Lastly, we will talk about a new drug that has been added to formulary at Cone Health. Vascepa, or icosapent ethyl, was just added to formulary. It is approved for hypertriglyceridemia and for CV risk reduction in patients with elevated triglycerides. The REDUCE-IT trial included many patients who are undergoing secondary prevention of cardiovascular events and have type 2 diabetes. The primary outcome was cardiovascular death, non-fatal MI, non-fatal stroke, coronary revascularization, or unstable angina. VASIPA showed a statistically significant reduction of the primary endpoint over time. In the graph, you can see the lines begin to diverge after 1 year of randomization. The acquisition cost of VASIPA and similar drugs are shown. The daily dose of VASIPA is 4 milligrams. A bottle of VASIPA is the amount needed for a 30-day supply. In summary, we talked about available generic inhalers, a new FDA indication for Trelegy, a new FDA drug approval, new dosage strengths for Trulicity, a new dosage form of tramadol, and a new drug added to the Cone Health formulary. A special thanks to Dr. Chris Walston and Dr. Christine Coe for their contributions to this presentation.